Welcome to Anatomy Reviews with Med Student. In the first video, we will discuss the clavicle bone. This is a bone of the shoulder which supports the upper limb and transfers the weight onto the axial skeleton. Looking at the picture of the clavicle, the picture above is the anterior view and the one below is the posterior view. For ease of study, we will look at the clavicle from four parts. The first part being the lateral one-third of the shaft, second one being the medial two-thirds of the shaft, and the lateral end and the medial end. Going into the details, the lateral one-third of the shaft has two borders, the first one being the anterior border, which has the origin for the deltoid muscle. The posterior border has the origin for the trapezius muscle. It also has two surfaces, the superior surface, which is subcutaneous, and the inferior surface, which has two major structures. The first one being the conoid tubercle, which provides attachment to the conoid part of the coracoclavicular ligament. The second structure being the trapezoid ridge, which provides attachment to the trapezoid part of the coracoclavicular ligament. Moving on and looking at the medial two-thirds of the shaft, it has four surfaces. Anterior surface, which has the attachment for the pectoralis major muscle. The posterior surface, where we have origin for the sternohyoid muscle. The superior surface, which has origin for the sternocleidomastoid. The inferior surface has two structures again. The first one being the impression for the costoclavicular ligament, and the second one being the subclavian groove, which is the insertion for the subclavius muscle. Going ahead and looking at the lateral end is covered by the shoulder joint capsule. Then, moving on to the medial end, it has three structures, which is the fibrous capsule, articular disc, and the intraclavicular ligament. Looking at different picture, here we can see the fibrous capsule, which is covering the entire medial surface. Also, we can see the interclavicular ligament, which is connecting between the two clavicles. And in the section which is the posterior part of the sternum and clavicle, we can see the articular disc. Looking at some clinical features, the common point of fracture for a clavicle is at the junction between the lateral one-third and the medial two-thirds, or rather, between the two curvatures. And this breakage is mainly due to falling on outstretched hands, which is also called as involuntary violence. The absence of clavicle at birth, or otherwise called congenital absence of clavicle, in partial or as a whole, is called cleidocranial dysostosis. Thank you for watching this video with Med Student.